Well, here we are again on the eve of Super Bowl. Yeah. How you doing on this day? You guys all prepped up for your Sunday celebration? Yeah, it's a big deal, huh? I know a lot of people that are in football pools and just enjoying the time with friends and family and eating a lot of chips and dip. I'm sure that the grocery stores are probably packed. And all the beer making breweries are very happy with their sales. Well, here I am. I'm going to talk about something that's very unpleasant that has nothing to do with football. Well, it could, I suppose, but I think everybody's going to be drinking their favorite beverage and not have to worry about anything called a UTI. As promised, it's a discussion about urinary tract infections. Oh, have you ever had one before? Not fun. Uh, I can recall a time or two that I had one when I was younger. And, that's the first thing I thought about as a caregiver to my parents, my elderly parents, whole different meaning. But I remembered when I had a bladder infection or urinary tract infection or something like that, this burning sensation when you urinated, or if you that feeling like you always had to go to the bathroom and then nothing would happen. It's frustrating. It's a nuisance, but it's something that's real and happens. So in my mind, when I was a caregiver for my parents, my dad didn't have it as much, and it's not really that men have it that often. It's just more prevalent in sedentary, bedridden patients, mostly female. And it has a lot to do with cleanliness, uh, dehydration. That has a lot to do with it. And there's so many different factors. So when I became a caregiver for my mom, I'm going to focus on her primarily because she was a bedridden patient. And my dad was still able, even up to the very last day of his life, he was still able to get up and move and go to the bathroom. If he wasn't able to go physically to the bathroom, he would use a urinal and all that, but he was still capable. Everything was good there. But my mom was a whole different thing because she was bedridden. Um, yeah, it's not really a fun subject, but it's a necessary subject. I know way too many people that have elderly family members, parents, loved ones. It doesn't matter. You have to have an understanding of what it's all about as a caregiver because it's very significant. You may not think about it, and I certainly didn't. But when I thought about what that was, I remembered what I felt like. But I was a whole lot younger. So, with that being said, a urinary tract infection um, can be treated if it's caught fairly quickly. Um, oh man, I have to find out. I didn't verify this. I think it was Cipro, uh, CIPRO. It's an antibiotic. It's fairly strong, and that was used to treat my mom's UTI. Um, what I want to do is I'm going to be sharing a couple of videos concerning urinary tract infections from Dr. Natalie Edmonds, who is a geropsychologist, and she is well versed in dementia care. And she basically helps guide and train caregivers how to deal with dementia patients, and she discusses UTI. I will be sharing that with you in a little bit. She's been a great help to me personally as a caregiver, and just information. She got into the business and started up Dementia Care Blazers simply because she recognized for all the years that she was dealing with hospital work that people weren't well versed in the profession of medical professions, that dementia was fairly overlooked. And by all means, caregivers were overlooked. And there was a lot of frustration involved. And she stepped up and said, I'm going to help people. And she did. I I'm very indebted to her impartation of information for myself, how it benefited me, um, and the support groups that she's built up through Facebook in Dementia Care Blazers, and as well online through Zoom meetings. Excuse me, these people have been invaluable to me um, during my mom's care and after my mom's care, since my mom's passing last June. Um, but Dr. Natalie has some great advice that I'll be sharing with you. And also, hospice nurse Julie McFadden, she wrote the book. Oh, God, what'd she write? Her book. Here, I'm going to show it to you. That book is amazing. And I want you to know that it helped us out so much towards the end of my mom's life. She's going to be speaking a little bit about what it's like to be, she's a hospice nurse, right? So she's going to know how to treat your loved one when they have a UTI and how hospice deals with it. Because, people think, oh, hospice, end of life, blah, 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 but there are certain things that they will treat. It's not like once you're in hospice, that's it, you're on your own. It could feel like that, but no, she addresses that. The one thing about a UTI that I could share with you about my mom, it creates a type of psychosis. The bad thing about older folks, whether they're dementia patients or not, they don't like to drink. And the problem with that is when you don't drink fluids, your body is primarily of water, right? The largest organ on your body is your skin. And you want to stay hydrated. Your muscles need hydration. If people constantly drink Gatorade or drinks like that, there's so much sodium in it, it actually depletes the muscles, right? There's good points and bad points, but if you're not sweating it out and you're just drinking that, well, then you're just ingesting more stuff that would replace the sweat. But if you don't sweat, then you're adding sodium to your body. I'm not a doctor, don't claim to be a doctor, but I will tell you this. Water is key. Nobody likes to drink water. I gave my mom watered down cranberry juice. Why cranberry juice? Well, it's great for your kidneys. If you have an infection of a bladder infection, a UTI, cranberry juice does the trick. A lot of times I wouldn't give my mom straight up because there's too much sweetness. Sometimes you got to watch the sugar intake. She was one person that would love the taste of that. So I would kind of do 50-50. And I put it in a baby bottle. And you ask why? Because my mom was sedentary. She didn't like to get up, even if she was able to walk at that time, or if she was in bed, she would think, hey, I'm laying down. What's the big deal? I'll just drink. Well, you give them a baby bottle, it doesn't drip and run down her neck and end up soiling the linen and all this other stuff. So I ended up giving my mom like a sippy cup or a baby bottle. And she didn't mind it. And I was happy. I didn't have to keep on cleaning their sheets. It just works. And those are things that you're going to figure out for your own loved one. But mom would have 50% water, 50% cranberry juice, and things that would entice her to stay hydrated. If she had bouts of diarrhea or anything like that, again, hydration is a key factor. You don't want them to dehydrate, especially if there's cases of uh, uh, a loose stool, diarrhea. I would give her Pedialyte. Yeah, there's some sodium in there too, but they also have Pedialyte, like frozen pops, like Otter Pops, those sticks. You stick them in the freezer. It's Pedialyte. Sometimes mom didn't want to drink things and she would think, oh, I'm getting like a little ice pop. And I would give her that. You can find them in the grocery stores. And again, they're like Otter Pops, but it's Pedialyte. I'd be really creative about mom's um, ways of getting her to drink juice or things like that. She always wanted coffee, and coffee is it kind of works against you. And I would limit the amount of coffee that she would have. It wouldn't be terrible, but I had to keep that within reason, keep that within check. Um, my goodness, what else was there? With mom, it was really a weird thing because I wanted to make sure that she didn't have bouts of diarrhea with the medicine she was taking, but then there was also the concern that she would be constipated, completely opposite. And you kind of had to like weigh out the pros and cons of everything. Sadly, um I had to make a log, literally a daily log. For years I made a log. How was her BM in the morning? Was she staying regular? Did she have a BM? If it was, how much? I mean, seriously, they were that bad, because the last thing you want to have is impacted bowels. Thank God we never got to that point, but I know people that have. And that requires hospitalization, and they go in and they do their procedure. And then it's a whole recovery thing. I wasn't going there. And neither was mom. Oh, but the UTI, it's so hard to get rid of because you don't want the body to stay stagnant. The key to a UTI of never getting one is to drink, flush out your kidneys and your bladder, drink, flush out your kidneys and your bladder. And see, mom was a kidney patient. She was at stage 3 kidney failure, renal failure, right? And so she would go every 3 months to see a nephrologist, and the nephrologist checks her kidneys and does the kidney health. And I had just gone through this with my dad, and I knew pretty much what to look for because I had gone through this with my dad up until his passing in November 2020. And so I knew that mom needed to stay within certain parameters of her numbers. I believe it was, if I recall, it's a GFR. And they basically say how much your kidneys were functioning and the ratio to which it's functioning. Before I started living with mom to take care of her, her GFR number was at 22. 22. If you get to 20 or below, you're doing dialysis. And I realized mom wasn't drinking as much as she needed to. She didn't feel like she needed to. And I tried all these creative ideas to get her to drink. And she was constantly having UTIs. She would act crazy. She would have these weird little fevers, acting like she was sick, constantly confused. She would be dizzy. She would fall. She would say crazy things. She would be angry and all these chaotic things. And I couldn't figure out what the problem was. Turns out they're all symptoms of a UTI. And I'm like, what is happening? And so I was trying all these different things, keeping track of her behavior and such. With me living there and me taking care of her and going to frequent nephrology appointments, I managed to get her number at 38. Never past 40. It hovered right. I think 38 was the highest number that I got. And for a few years, I managed to keep her at 34 or 33. Quite the difference of 22 when I first started with her. And, all it did was inspire me to encourage mom to drink more. And the other thing, too, is that when mom was living on her own before I arrived there to live with her, her hygiene was not great. She may have thought she was doing well, but the truth of the matter, she was not. And so that was hard. And then the more that she became sedentary, the more that she became bedridden, because eventually atrophy, her muscle mass in her legs gave out. So she ended up becoming bedridden. So I was cleaning her more frequently and making sure that there was no chance of any type of infection to take place. Women, we don't have it like the guys. There's a lot of stuff that can happen down there. And if it's not clean, I mean, I don't need to tell you that. You know that. It's not fun. And, let's put it this way, yeast isn't just for baking. Did I say that? I did, huh? I'm just telling you, man, there's things that people have to deal with that never get talked about or dealt with. So let's just be real with each other. This is not a great subject, but it's a necessary one. So anyway, when mom was going through all this stuff, I would go to my sister-in-law, Charlene, who's a nurse practitioner. And I couldn't get mom to go to the bathroom so that I could do a test or anything like that. And she came over and she said, "Hey, I have these test strips. Can you get your mom to do a sample?" I said, "No." And the problem with a bedridden dementia patient, she didn't feel the sensation of having to go to the bathroom. So that was part of a problem too. Didn't matter if it was one or two. She didn't have the sensation of having to go. So when I would ask her, "Could you just give me a sample so I can at least have it tested?" She said, "Sure," but she couldn't perform. Call it stage fright. So, so I don't, it was tough. I had the PCP, give me a supply kit because they knew what my problems were. They would give me the quote unquote party hat. And the party hat is what you put in on the toilets, and it's like a catch basin, and then when you get the sample, you just pour it into the sample cup, and they gave me cups and all that stuff and the wipes, the whole shot, so I could do everything at home and then have it tested. As mom's condition advanced, and I would hire a lab service to come to the house to take samples, because what do you do when there's somebody bedridden? And I was here trying to carry my mom with dead weight onto the wheelchair to the car and then to the facility at the lab to do the test and then it was just a crazy thing. So I would get a lab service to do something like that. And we would have this, but Charlene was telling me, we could do it this way. If you put plastic wrap on the toilet seat underneath the rim and kind of make like a little dip, like a bowl. And if they go to the bathroom, then at least we can, if they do urinate into that, then that little cellophane, the plastic wrap, will then catch some urine, and then you could take the test strip and test it that way. We tried it and it worked. And, I did everything like, here, mom, put your finger in the warm water in a cup to, or I would turn on the sink water to help encourage some urination. I mean, I did everything just to try to get a sample. Um, so, there were creative ways to collect samples and to do that, but the trick was to keep her clean. Bottom line, keep her clean and keep her hydrated, because dehydration would then create a UTI. And once you get it, they can become so severe. I'm going to tell you a story. Deborah and I were in Colorado, and my mom was still able to stay on her own, and she was able to move around. She was mobile at the time. And I noticed at one time she didn't answer the phone. And we had come back from Denver. And I was like, Mom, she's not picking up the phone, blah, blah, blah. My sister wasn't living in California. A friend of my sister's met me at my mom's house because I started to think the worst, because I can't remember why, but it had been a few days since I had heard from mom. And I tried to call and she wasn't picking up the phone. Anyway, so we ended up at mom's doorstep. And being at mom's doorstep, she I seriously thought the worst. And my sister's friend Kim met me at the house and said, "Do you want to go in?" And she goes, "Here's a tissue." And I put peppermint on it. And I looked at her like, "Why?" She goes, "Well, you haven't talked to your mom in a while. And um, what if it's the worst?" And that was sobering, to have to think that possibly something really bad happened. And I said, "I can't go in. I don't want to be the first person." She goes, "I'll do it." She goes, "But in case your mom has been out of commission for some time, we don't know what we're going to find. Here, take this tissue with the peppermint on it." That freaked me out. But okay, I didn't know. I wasn't living with her then. So Kim opens up the door, and you go in through like a little laundry area, and then you go immediately to the left, and there's the kitchen. And she opens up the door and she goes, "Rita, Rita." And she kind of heard my mom faintly. And she opened up the door and she goes, "Oh my God, Rita," like that. And she goes, "She's okay. She's alive. She's okay. She's okay." But when I walked in, my mom was laying on the kitchen floor, butt naked. We're like, "How long have you been here?" "Oh my gosh," and called 911, tried to cover my mom, make her a little bit more modest, but these guys showed up fast. Go figure. They showed up fast. Long story short is mom thought she was there for days, but I didn't see any type of defecation or any type of urination on the floor or anything like that. So that led me to think, you haven't been there that long. They checked her out and it was a UTI. It was a severe UTI. So that was weird. The weird thing about it too is because mom was able to converse, even though I was her power of attorney and her health care directive, and you name everything under the sun I was for her, they didn't talk to me. They didn't talk to me because my mom was able to have a conversation. In the ER, in the hospital world, my mom was of sound mind. And I'm like going, now I'm her caregiver, but I wasn't living there at the time. So it was kind of weird. I got a weird vibe from everybody. And I had to fight to speak to somebody that would listen to me. But not long after that, the reason why I moved into my mom's was because my mom fell again. And UTIs will do that. They will cause dizziness, they will cause imbalance. And somehow, some way, my mom hit her head in the kitchen and claimed she was okay. For whatever reason, I don't recall, Deborah went to the house. And when she went to the house, she said, "Yeah, Carolyn, you know what? She was there's a pool of blood in the kitchen. Apparently, she just dabbed her head wound, laid down, and now the pillow was all saturated with blood. And of course, I took her to the hospital, and she checked out okay. She had an MRI, whatever else testing. Mom was fine. She had a bump here in the front, and as she hit her head in a couple places, she couldn't describe really what happened. But it was then when the ER doctor goes, "Who's staying with her?" And that I was just realized it's got to be me. I guess I am. And it was never the same since. So that head injury, and again, it was a UTI. And I realized that mom needs to have somebody to help her stay hydrated. Mom needs somebody to guide her, clean her. She could no longer do it on her own because she was never getting rid of the UTI. And on a side note, I know of a family member, someone dear to us, that ended up with the UTI, also fell. And it was just a downward spiral. And if the UTI is not properly taken care of, sometimes they can be so severe, it infects your blood, and that person can become sepsis. And my mom was on the verge of becoming sepsis at one point, but this loved one that I'm referring to did become sepsis and succumb to that. It's like once it gets in your bloodstream and it gets that aggressive, it's very, very difficult to rise above that because it can affect a bunch of stuff that you don't even think about. And, it's like a battle. And you have to find creative ways to use those weapons to combat it. Because you don't always want to go to your antibiotic of Cipro to clear up this, because I think I'm not a medical professional, but if you take something long enough, you build up an immunity, a tolerance to it, and then it doesn't work anymore. You certainly don't want that. Oh, but I'll tell you what, I promise you that there's going to be certain signs, clues that you're heading down the UTI highway. And Dr. Natalie's going to be explaining something. Let's find out what she says.
Signs of a UTI are so that you can identify them sooner in your loved one and get treatment for it right away. Because when people get UTI, and here's the first early indication, many times their behavior changes suddenly. So I'm talking about increased confusion, increased agitation, maybe even increased aggression. If your loved one with dementia tends to already be irritable and aggressive or confused, a UTI can make it so much worse. It almost seems like overnight, all of a sudden, they got worse. So sudden changes in behavior is one early indication. Another indication is a sudden change in their thinking abilities, usually them becoming more confused. We refer to this as delirium, and I've done an entire video on this important topic. People with dementia are more likely to get delirium as well. And so I'll be sure to link to that video in the show notes below. But we're looking for sudden changes in behavior, sudden changes in thinking, increased confusion, having difficulty speaking or remembering things they normally wouldn't. Another thing that can often happen are hallucinations, where your loved one might see or hear things that are not there. This, especially if your loved one does not have hallucinations at baseline, like if they don't normally see or hear things that aren't there, but all of a sudden now they are, this could be a sign that a UTI is present. Look for any significant changes in their daily habits. So any changes suddenly in their appetite, in their sleeping schedule, in their level of alertness. Maybe they seem more drowsy, or maybe they seem super, super elevated. Physical changes can also be an indication. So looking for things like frequent falls, maybe touching their belly area a lot, touching their abdominal area more than usual, like a sign of physical discomfort. And then finally, the most obvious early indication that your loved one might have a UTI is that literally incontinence changes. Maybe they're suddenly having more bathroom accidents, urinating themselves more often, going more frequently. You might even be able to smell a difference in their urine. All signs of UTI could be present.
It's interesting, huh? It's so interesting because it's the last thing you think of. It's so different to have a UTI than when you have it when you're younger. It's so different. And when a person has Alzheimer's or any type of the different dementias, it puts a whole different level of caregiving and understanding. I mean, they can't explain what they're going through, but there's plenty of clues out there. Now, for those of you that are dealing with Alzheimer's or dementia patients that are entering into hospice, let's check out what hospice nurse Julie says about the subject.
If your loved one with Alzheimer's or dementia is going in and out of the hospital because of UTIs and you're considering hospice, if they go on hospice, we will still treat those UTIs. If they can swallow antibiotics or crush antibiotics, we will definitely still give them antibiotics for UTIs. So that's one. And two, if they can no longer swallow or can't take the antibiotic, we will treat the symptoms of the UTI so they will not suffer. We can give them pain medicine. We can give them Tylenol, suppositories for fever. So we definitely can help them with the symptoms of the UTI, which is very, very common. So we'll make sure your loved one is not suffering.
It's pretty cool, huh? They will treat certain things in hospice, and there are certain things they will not treat. But when it comes to UTI, it's about comfort, care, and cleanliness in hospice. Comfort. Is it going to create some sort of discomfort if you have a UTI? Sure. Cleanliness. Hey, you got to be clean. And they're not going to allow your loved one to be suffering. And care. Yes, of course. They're going to be there to help. And they're there to help you too. Like, subscribe, like, subscribe, or share this video. Play it again, learn something from it because it is a very prevalent issue in caregiving. You know, I can't say enough about it. Kind of went a little bit longer than I wanted to, but I want you to know there is hope and there is a way to fix things. It's called education because knowledge is power. Hey, be blessed and always be good to yourself. Take care.